structured version of the lecture to help with memorization and understanding. Dr. Mansour's Aesthetics Lecture, Key Points. 1. Implant Positioning. Ideal placement. The implant should ideally be placed at the site of the cingulum of the central tooth, positioned slightly palatal to the labial surface. Consequences of labial placement. If the implant is placed too far labially, the tooth may appear longer. Correcting this may require adding pink porcelain, which is challenging due to matching the gingival shade. Soft tissue grafts are not effective here because of insufficient bone support. Surgical guide. A conventional surgical guide is sufficient for both prosthetic and surgical purposes. 2. Aesthetics and shade selection. Importance of shade. Shade is the most crucial factor in aesthetic perception. Proper shading and color selection can hide other defects in the restoration. Porcelain glazing. Use a porcelain furnace for glazing the restoration. Characterization can be done either in the blue phase or after crystallization. 3. Material selection. PFM, porcelain fused to metal, issues. PFM restorations can give a grayish appearance due to metal underneath. To avoid this, reduce tooth structure more to increase porcelain thickness. All ceramic restorations. If using a metal abutment with all ceramic restorations, it might cast a shadow under the porcelain. Solution: use a ceramic abutment instead. 4. Overcoming metal display in all ceramic restorations. Material choice. Use low translucency material to minimize metal display. Thickness adjustment. Decrease material thickness on the labial side by placing the implant slightly palatal. Cement choice. Use opaque cement to block metal visibility. The implant-supported restoration. 1. Cement usage. Opt for opaque cement to avoid translucency issues. 2. Porcelain selection. Use gold zirconia where the border is built out, it's non-translucent. 3. Abutment color. Check the abutment's color. Gold-colored collars or full gold abutments may be problematic because they might be visible under the gingiva. This could lead to a yellowish shadow under translucent materials. 4. Gold abutment issues. The gold color may need to be removed if it's too prominent. 5. Anodizing the abutment. Anodizing can change the abutment's color. Process: use distilled water with 20% citric acid as the electrolyte. The abutment acts as the anode and tinfoil as the cathode. 6. Voltage control. Control the voltage to alter the abutment's color by forming an oxide layer. The oxide layer's thickness controlled by voltage changes the color. 7. Oxide layer thickness. Increasing the oxide layer's thickness raises roughness but doesn't affect bond strength. Screw versus cement retained restorations. 1. Aesthetic concerns. Key factors. 1. Restoration material. 2. Position of the screw access channel. Guidance. For aesthetics, avoid PFM and use all ceramic materials. If the screw channel is labial, opt for cement-retained crowns. Correction. Use pink porcelain or another method to hide the screw channel. 2. Emergence profile. The profile is how the tooth emerges from the gingiva. Natural versus implant teeth. In natural teeth, the profile is often triangular. In implants, it's rounded. Healing abutment impact. When the healing abutment is removed, bleeding may occur due to soft tissue attachment. Modification needs: modify from rounded to triangular 2 to 3 millimeters if needed. 3. Implant diameter. Wide versus narrow diameter. Narrow implants can create hygiene and aesthetic issues, leading to food impaction or black triangles. Prefer a wide diameter to create a better emergence profile. 4. Implant positioning. Ideal placement: position the implant 2 to 3 millimeters from the margin of neighboring teeth. Grafting needs. If aesthetics are critical, graft first before placing the implant. Key takeaways. Proper implant positioning, material selection, and aesthetic considerations are vital. Address issues like metal visibility and emergence profiles to achieve the best aesthetic outcomes.